Welcome to the deep dive. We all know feeding too much grain can, you know, upset a cow's stomach.
Sure, that's common knowledge.
But have you ever really thought about the true scale of something like lactic acidosis? It's this complex metabolic disorder, and it's quietly costing the global cattle industry, well, hundreds of millions, maybe even billions, every year.
It's staggering when you look at the numbers, really. A silent profit robber, as you called it.
Exactly. So today, we're not just going to define grain overload. We're diving deep into the sources you've sent us, unpacking the critical insights.
Yeah, trying to understand why it's so significant economically, how it actually messes up the animal system.
And looking at the latest strategies, right, for diagnosis, treatment, prevention. Think of this as your shortcut to really getting a handle on this huge challenge in livestock health.
Sounds good. Where should we start?
Let's start with the basics, although calling it basic might be, well, underselling it a bit. At its core, what exactly is lactic acidosis in cattle?
Okay, so it's defined as a metabolic disorder in ruminants. Fundamentally, it's characterized by a pretty severe drop in the rumen's pH.
The acidity level in the main stomach compartment.
Exactly. Normally, a healthy rumen keeps its pH between, say, 5.5 and 7.0. But with lactic acidosis, it can just plummet way below that range.
Wow.
The main issue, and this is what makes it so tricky, is an imbalance in how the rumen's microbes handle acids, specifically how they produce, use, and absorb them, especially lactic acid.
And I notice it goes by a whole bunch of names. That usually tells you something, doesn't it? Like how common or varied it is.
Absolutely. You hear ruminal acidosis, grain overload, grain poisoning, corn toxicity, carbohydrate engorgement.
All pointing to the same root cause.
Pretty much, yeah. They all point back to that same underlying problem. Too many rapidly fermentable carbohydrates hitting the system at once. But while the cause is similar, how it shows up really falls into two main forms. Two sides of the same, very problematic coin, you could say.
That's a great way to put it. Okay, let's break down those two forms. Maybe start with a really dramatic one, acute ruminal acidosis. What's that crisis state look like?
Right. Acute is definitely the crisis form. It's characterized by this really rapid, profound drop in ruminal pH.
How low are we talking?
We're often talking below 5.0. Sometimes, believe it or not, it can get down to 3.8.
Goodness, that's incredibly acidic.
It is, and it's typically triggered by the animal suddenly eating a large amount of highly fermentable carbs. Think a cow breaking into the grain store or a really abrupt, massive diet change.
Okay, so that sudden flood of carbs hits the rumen. Then what?
Well, it causes this dramatic shift in the microbes. First, the starch-digesting bacteria just explode in population, producing tons of volatile fatty acids, or VFAs. That causes an initial pH drop.
But that's not the worst part.
No, here's where it gets really destructive. As that pH keeps falling, the beneficial bacteria, the ones that normally consume lactate, like Megasphaera elsdeni and Celanominus ruminantium, well, they just can't handle the acid. They start dying off.
Yeah.
And that leaves the door wide open for the acid-tolerant bacteria, the ones that produce lactate, especially
Right.
Streptococcus bovis initially, and then later lactobacilli, to just take over and proliferate.
And lactic acid is the real problem here.
It's a huge part of it. The key thing is a lactic acid is roughly 10 times stronger than the other VFAs.
10 times.
Yeah. So that just intensifies the pH drop incredibly quickly. It's a vicious cycle.
Wow, okay. That really paints a picture of how fast things can go wrong in the acute form. But you said there's another side to this coin, the more common challenge, Sarah. Subacute ruminal acidosis.
That's right. SARA is definitely the more common form, especially in dairy cattle,
Yeah.
and it operates much more subtly.
How so?
Well, unlike the acute crisis, SARA is characterized by these sort of intermittent periods where the rumen pH dips below critical levels. It might drop below, say, 5.6 for maybe 3 hours a day, or below 5.8 for 5 or 6 hours. It often corrects itself, but those dips keep happening.
So it's not that constant plummeting pH.
Not usually. The pH depression in SARA is mostly due to just too much VFA accumulation, although lactic acid can still play a role. But the real challenge with SARA is that the clinical signs are often really subtle or delayed or just nonspecific.
Making it hard to spot.
Incredibly hard to diagnose in real time on a farm. The true genius, or maybe the peril of SARA, isn't just the subtle symptoms, it's how it often looks like a bunch of other common farm issues.
Like what?
Like, maybe milk yield is just slightly off, or there's a bit of lameness, or fertility isn't quite what it should be. It's a master of disguise, really. Few people connect those dots back to what's happening in the rumen.
So it's not one big event, but more like a constant drain.
Exactly. It's a chronic erosion of potential, often hidden in plain sight. Which brings us back to that silent profit robber idea.
Yeah, let's talk about that economic burden, because Sarah, with those hidden costs, that seems key. Could you give us a clearer sense of how those hidden costs actually show up day to day on a farm? Why are they so hard for producers to really pin down?
Absolutely. And your sources consistently rank lactic acidosis, both forms really, second only to respiratory diseases when it comes to hitting animal performance and efficiency globally.
Second only to respiratory disease, that's huge.
It is. Now, the direct costs of acute acidosis are pretty obvious, sadly. You can have rapid deaths, often within 24 to 72 hours.
Right.
Animals that survive grain overload might just not grow well for, up to 6 winks. With Sarah specifically, studies show it can cut dry matter intake by maybe 15%, drop milk yield by over 3 kilos a day, reduce milk fat.
Significant numbers.
Very. And then there's culling. Animals might just become poor doers because of secondary issues, maybe infections, and have to be culled early. Plus, the vet bills, medication, maybe even surgery for acute cases. Those are direct hits.
Okay, so those direct costs are clear, even if they're devastating. But you're saying the really insidious part is the indirect stuff, the underestimated losses from Sarah.
Precisely. That's where the silent robber part comes in. The North American dairy industry, just as one example, reportedly loses somewhere between $500 million and $1 billion a year just to Sarah.
Wow, $1 billion?
Yeah, estimated at about $1.40 per affected cow per day. In Europe, Sarah rates can be as high as 26% in mid-lactation dairy cows. China sees rates from 9% to 26%. It's widespread.
And how are those costs hidden? You mentioned it looking like other problems.
Right. A perfect example is liver abscesses.
Ah, yes. I know that's a major issue, especially in the beef industry. Is that directly linked?
It is, very strongly. And it's a prime example of a hidden cost. Liver abscesses alone cost the U.S. beef industry something like $256 million a year.
Yes.
That works out to over $9 per animal sold.
And that affects growth.
Definitely. Reduces average daily gain by about 5.3%, which doesn't sound huge, but it adds up. Beyond that, Sarah contributes to poor feed efficiency, messes with reproduction, makes animals more susceptible to other diseases. Lameness is another big one often linked back to it.
So a farmer might just think, oh, it's been a tough year, or that cow just isn't a great performer.
Exactly. They might blame genetics or just bad luck, when really it's this underlying, unaddressed Sarah quietly chipping away at their bottom line. It's the cumulative impact of all these small, constant productivity losses,
Right.
rather than one big, obvious illness.
That really does reframe the whole issue. Okay, so knowing that, let's get into the science. How does this cascade of sickness actually unfold inside the animal? What's the primary trigger that kicks it all off?
The main culprit, overwhelmingly, is the animal eating large amounts of readily digestible, highly fermentable carbohydrates.
Like grains.
Yeah, common grains like corn, wheat, barley, oats, sorghum, even things like bread or other processed byproducts. Your sources specifically flag wheat and barley as being particularly risky because they ferment faster.
And how you process the grain matters too.
Oh, definitely. Finely grinding the grain makes those carbs available even faster for the microbes to ferment, so that increases the risk significantly.
Okay, so those carbs flood the rumen. How exactly does that start to unravel the whole microbial ecosystem in there? It's usually pretty balanced, right?
It is normally, yeah. But that sudden influx of fermentable carbs throws everything off. First, you get that rapid boom in starch-digesting bacteria. They produce a lot of VFAs very quickly, causing that initial pH drop we talked about.
Okay.
But here's the critical turning point, the really interesting part biologically. As the pH drops further, those beneficial lactate-consuming bacteria, like Megasphaera elsdeni, they just can't cope with the acid. They die off.
Leaving a gap.
A huge gap, and it gets filled by the acid-tolerant lactate-producing bacteria. Streptococcus bovis kicks in first, then lactobacilli really take over. They thrive in that acidic environment and just multiply like crazy.
Leading to that second, much more severe pH drop because of all the potent lactic acid.
Exactly. Because the lactic acid is so much stronger, about 10 times stronger, as we said, it spirals downward quickly.
And this severe acidification, it must do damage beyond just killing off good microbes.
Yeah.
What does it do to the rumen itself?
Oh, absolutely. A pH below 5.5, and especially below 5.0 in acute cases, it's devastating. It destroys beneficial protozoa, kills off the fiber-digesting organisms, so digestion basically grinds to a halt.
Mm.
Rumen motility, the contractions that mix everything, that severely slows down or just stops completely, that's called atony.
So food just sits there.
It traps feed and fluid, and worse, it actually pulls fluid out of the body's tissues into the rumen because the high acidity and osmolarity,
Huh.
that leads to systemic dehydration, even while the rumen is full of fluid.
That sounds counterintuitive, but dangerous.
It is. And on top of that, the low pH causes chemical rumenitis. It literally erodes and ulcerates the rumen lining. It's like, well, pouring acid onto sensitive tissue.
So clearly not just a localized gut issue. You mentioned a domino effect, systemic consequences. What happens when things escape the rumen?
Precisely. It becomes a whole body problem. That lactic acid, particularly a form called D-lactate, which mammals don't metabolize well, gets absorbed through that damaged rumen wall into the bloodstream.
And that causes...
severe metabolic acidosis throughout the body. Blood pH drops, bicarbonate buffers get used up, serum lactate levels shoot up. This can lead to things like hemoconcentration, thickened blood, cardiovascular collapse, kidney failure, shock, and ultimately death.
It can even affect the heart directly.
Yes, hyperkalemia, high potassium levels can develop, which can potentially lead to cardiac arrest. It's a true systemic emergency in acute cases.
And what about inflammation? Is there a broader inflammatory response triggered by all this?
Yes, definitely. When the rumen microbial balance gets so disrupted, gram-negative bacteria die off and release endotoxins, specifically lipopolysaccharide, or LPS.
Okay.
This LPS can leak through that damaged rumen lining into the bloodstream. That triggers a strong, widespread inflammatory response throughout the animal's body.
And that inflammation can lead to organ damage elsewhere.
It can.
Yeah.
We already talked about liver abscesses. That happens when bacteria, mainly Fusobacterium necroforum, leach from the inflamed rumen, travel to the liver, and set up infection. Those abscesses can then lead to peritonitis or even sudden death if they rupture.
And lameness, too. How does that connect?
Yeah, it's thought that vasoactive compounds released during acidosis and the inflammatory response can damage the sensitive tissues in the hoof, weakening them and making the animal much more prone to developing laminitis or lameness. In really severe cases, you might even see infections pop up in the lungs, heart, or kidneys.
So diet is obviously the main trigger, but it sounds like other things can increase the risk. It's multifactorial, isn't it?
It absolutely is. You can't just point the finger at the grain. It raises that important question about how management and the environment can really stack the deck against the animal.
So what are some of those other factors?
Well, dietary factors beyond just what they eat include how they eat. Sudden diet changes are a big one. The rumen needs time, like 3 to 5 weeks, to adapt its microbial population.
Okay.
Not having enough physically effective fiber is another huge factor. That's the long, coarse stuff that makes them chew their cud, produce saliva, which acts as a natural buffer.
Right. Saliva buffers the acid.
Exactly. Also, animals sorting their feed, picking out the tasty grain and leaving the fiber, that's a problem. And as we mentioned, how finely the grain is processed.
What about management practices?
Oh, lots there. Inconsistent feeding times, letting feed bunks get empty so cows gorge when feed arrives. Overcrowding is a big one. Not enough space at the bunk means more competition. Some cows eat too fast, others don't get enough. Less than maybe 60 centimeters or 24-30 inches per cow is asking for trouble.
Makes sense.
Also, simple errors in calculating or mixing the ration. Even overmixing a total mixed ration, or TMR, can break down the fiber particles too much, reducing their effectiveness. And feeding groups can be tricky because individual cows vary.
And the environment itself, can that play a role too?
It can. Extreme temperatures, especially heat stress, seem to reduce the rumen's natural buffering capacity, makes them more susceptible. Muddy pens, storms, basically anything that causes stress can alter feeding patterns and contribute to the risk. It's a really complex web.
Okay, so given how complex it is, and especially how subtle Sarah can be, how on earth do you actually diagnose it in the real world? It sounds incredibly difficult to pinpoint sometimes.
Diagnosis is challenging, especially for Sarah, because the signs are so varied and often nonspecific. For acute cases, it's usually more obvious. You see that rapid onset 8 to 24 hours after the overload.
What are the signs?
Severe depression, lethargy, dehydration, signs of abdominal pain like kicking at their belly. The rumen feels distended, doughy, and the contractions are weak or totally absent. Often there's profuse, watery diarrhea, sometimes with a characteristic sweet, sour smell, maybe foamy, with undigested grain visible.
Grim. What are the terminal signs?
Towards the end, you might see staggering, inability to stand, eventually coma and death, often within 24 to 72 hours. Vets often look at heart rate. If it's over 120 beats per minute, the prognosis is usually pretty poor. And something else, pregnant animals that survive might abort 10 to 14 days later.
Okay, acute is dramatic. But Sarah, that's the master of disguise, as you put it. What are the telltale signs you look for there?
The clues. Yeah, with Sarah, you're hunting for those subtle, insidious clues that are easy to dismiss. The primary indicators are often things like fluctuating feed intake up one day, down the next, and/or inconsistent milk production.
Okay.
A really common and strong indicator is a drop in milk butter fat, say below 2.5% for a Holstein cow, or if the ratio of milk fat to protein drops below about 1.15 to 1.
Interesting. What else?
Variable manure consistency is another clue. Maybe it's yellowish, has that sweet, sour smell, looks foamy, or you see whole grains passing through. Unexplained lameness, finding those liver abscesses at the processing plant, cows just looking a bit rough or having poor body condition despite seemingly getting enough feed, and maybe higher than usual culling rates in the herd. It's about connecting those seemingly unrelated dots back to potential rumen issues.
So beyond just looking at the animal, what tools do vets or farmers use to get a more definitive diagnosis? Lab tests, field methods?
Rumen fluid analysis is really considered the gold standard, especially for measuring pH. In acute cases, the pH will be really low, typically below 5.0. For Sarah, you're looking for pH values dipping below 5.5 or maybe below 5.8 for extended periods, like several hours a day.
How do you get that fluid sample accurately?
The best way is rumenocentesis. That's where you use a needle to draw fluid directly through the body wall into the rumen. It avoids contamination with saliva, which would buffer the sample and give you a false high reading. You ideally want to sample 2 to 8 hours after feeding, as that's usually when the pH hits its lowest point.
And for checking a whole herd for Sarah?
You'd typically sample maybe 10 to 15 cows to get a representative picture of the group. You can also look at the fluid under a microscope. In acute cases, you'll see shifts like way more Streptococcus bovis or Lactobacillus and fewer of the normal protozoa.
What about blood tests?
Blood tests can confirm systemic metabolic acidosis. You'll see low blood pH, low bicarbonate, high serum lactate. Liver enzymes like AST might be elevated if there's liver damage. And just looking at the manure for undigested grain or that foamy appearance can be another piece of the puzzle.
And I guess post-mortem findings are pretty definitive too.
Absolutely. Necropsy is crucial for a definitive diagnosis after death. You'd look for that distended rumen, signs of rumenitis like erosions, inflammation, ulcers on the rumen lining. And finding liver abscesses is a very common supporting finding.
Okay, so with all these diagnostic challenges, especially for Sarah, it sounds like innovation is really needed. What's on the horizon?
It absolutely means innovation is key. Research is exploring things like computerized ways to assess the color of the rumen lining, or looking for novel biomarkers like D-lactate in blood or maybe LPS levels in manure.
Interesting.
But where it gets really exciting for practical farm use is the emergence of precision feeding technologies.
Like sensors.
Exactly. Real-time sensors, often in boluses the cow swallows, that can monitor things like reticular rumen pH, temperature, the cow's activity level, even components in the milk. These can give early warnings of Sarah developing, allowing farmers to intervene proactively before clear clinical signs show up. That's potentially a game changer for prevention.
That really does sound like a huge leap forward, moving from reacting to crises to preventing them. Now, let's say you do have a cow in an acute lactic acidosis crisis. It sounds like a true medical emergency. What are the immediate steps?
Acute lactic acidosis is absolutely a medical emergency. Fast action is crucial. Often the first step is rumen evacuation, basically getting the source of the acid out.
How do you do that?
It can be done surgically through a rumenotomy, where you actually open the rumen, or sometimes by flushing the rumen with large volumes of water through a stomach tube called rumen lavage.
Okay, get the bad stuff out. What next?
Fluid and electrolyte therapy is critical. These animals are usually severely dehydrated and in metabolic acidosis. So intravenous fluids, often hypertonic saline, followed by solutions containing sodium bicarbonate, are needed to rehydrate and correct the blood pH.
And neutralizing the acid still in the rumen.
Yes, giving alkalizing agents orally is important. Things like a drench of sodium bicarbonate, maybe 130 grams or so, or magnesium oxide, about half a gram to a kilogram of body weight, can help neutralize the rumen pH directly.
Makes sense. What about supportive care? The animal's been through a massive shock.
Supportive care is definitely needed. This often includes broad-spectrum antibiotics because that damaged gut lining allows bacteria to leak out. NSAIDs, non-steroidal anti-inflammatories, help with inflammation and pain. Antihistamines might be used. calcium supplements sometimes, and critically, thiamine, vitamin B1.
Why thiamine?
Because the rumen environment changes can disrupt thiamine production or availability, and a deficiency can lead to a serious neurological condition called polyencephalomalacia. So giving thiamine is preventative.
Okay. Anything else?
Transdonation can be very helpful. That's transferring healthy rumen fluid, maybe 10 or 15 liters, from a healthy donor cow into the sick cow's rumen. It helps reestablish the beneficial microbial populations.
Like a probiotic transplant for the rumen.
Exactly. And diet-wise, you'd withhold all grain or concentrates, offer only good quality hay, and introduce water gradually as the rumen starts to recover.
Okay, that covers the acute emergency. But with Sarah, you said it's more about ongoing management to stop it recurring, right? Not really a one-off treatment.
That's exactly right. For Sarah, there's no magic bullet treatment once the pH is dipped. It's all about continuous management to prevent those dips from happening again or making them less severe.
So how do you manage it? Diet first.
Diet adjustments are absolutely key. You need to formulate diets with enough physically effective fiber. We're typically aiming for a neutral detergent fiber, or NDF, level of around 28% to 30%, and controlling the non-fiber carbohydrates, keeping them maybe in the 38% to 41% range.
And particle size matters for that fiber.
Critically important. You need long enough particles, generally over, say, 5 centimeters, to stimulate chewing and prevent sorting, but not so long they can't be handled easily. And maybe the most crucial point, any diet changes have to be gradual. Over 2 to 3 weeks minimum to let those rumen microbes adapt.
Right. Avoid those sudden shifts. What about feed bunk management?
Also vital, making sure there's enough space for every cow to eat comfortably without intense competition, that minimum of 60 centimeters or 24-30 inches per cow we mentioned. Delivering feed more often, maybe twice or even 3 times a day, and pushing feed up frequently encourages smaller, more frequent meals. That helps stabilize rumen pH, avoiding those big dumps of carbohydrate after a period of hunger.
And the mixing of the feed.
Yeah, avoiding overmixing a TMR is important. If you mix it too long, it breaks down the fiber particles too much, reducing their effectiveness in stimulating chewing and buffering.
Okay, diet and management. What about feed additives? Are there things you can add to the ration to help?
Definitely. Strategic feed additives can play a significant role. Buffers and alkalizers are common things like sodium bicarbonate, often added at around 0.75% of the total ration dry matter, or sodium sesquicarbonate, potassium carbonate, magnesium oxide. They directly help stabilize rumen pH by neutralizing excess acid.
Like Tums for cows.
Sort of, yeah. Then there are direct-fed microbials, or DFMs, probiotics, essentially. Supplementing with specific yeasts or bacteria like propionibacteria, lactobacilli, and enterococci can help enhance the utilization of lactate by the beneficial microbes that are still there.
Interesting. What about ionophores? I know things like monensin are used.
Yes, ionophores like monensin sodium can be quite effective. They work partly by inhibiting some of the lactate-producing bacteria, and they also tend to improve overall feed efficiency. Monensin is often recommended at around 300 milligrams per cow per day, and it's also approved for helping prevent ketosis.
Any other additives being looked at?
There's ongoing research into organic acids, like malic acid and fumaric acid. The idea is they might help stimulate the bacteria that use lactate, but that's still more in the research phase compared to buffers or ionophores.
It really sounds like prevention is where the biggest gains are to be made for the industry long term. What are the core proactive strategies beyond just reacting when you see signs?
Proactive prevention really comes down to integrating everything we've talked about. Meticulous nutritional management is number one.
Meaning?
Gradual diet adaptation, always. Taking that 3 to 5 weeks when moving cows onto higher grain diets, ensuring rations are properly balanced, adequate, effective NDF, controlled non-fiber carbs, and paying attention to how feeds are processed to maintain that functional fiber.
Okay, nutrition first. What about herd management?
Consistent feed delivery and intake patterns are huge, ensuring that adequate bunk space, regularly monitoring the cows not just for milk production but for behavior. Things like rumination time, how long they spend chewing their cud, can actually start to decrease several days before you see other signs like lower milk fat.
So tracking rumination could be an early warning system.
It absolutely can be. Also, body condition scoring, avoiding cows getting overconditioned before calving, can reduce risk. And generally mitigating stress, whether it's from weaning, transport, handling, or environmental factors like heat stress or muddy lots.
And you touched on some novel prevention strategies earlier, the really cutting-edge stuff.
Yes, the most exciting advancements are really shifting the paradigm. Those precision feeding systems we mentioned, using real-time sensors in individual cows to monitor rumen pH, temperature, activity, milk components.
Allowing tailored interventions.
Exactly. It allows for truly individualized nutritional adjustments and gives incredibly early alerts for potential metabolic problems like Sarah, moving from treating the herd average to managing the individual cow proactively.
That sounds revolutionary. What about the vaccines you mentioned?
That's another really promising area, maybe a bit further out for widespread use, but fascinating. Research is actively exploring vaccines targeting those key D-lactate-producing bacteria like Streptococcus bovis and certain lactobacillus species.
How would that work?
The idea is to stimulate the cow's immune system to control the populations of these specific bacteria in the rumen, preventing them from overgrowing when conditions might otherwise favor them, like after a carbohydrate challenge. Studies have shown some real promise in reducing the severity of acidosis.
Vaccinating against bad gut bacteria. That's incredible.
It really opens up new possibilities for prevention.
We've certainly covered a huge amount today, from the tiniest microbes in the rumen right up to the billion-dollar economic impacts across the industry. So, wrapping this up, what's the big takeaway here? What does this all mean?
Well, connecting it all back, I think the main point is that lactic acidosis, whether it's the acute crisis or the sneaky subacute form, Sarah, it's just this pervasive, economically damaging challenge. And it's driven by this really complex mix of diet, management, and the animal's environment.
It's not just one thing.
Not at all. But what's really insightful, I think, is seeing how a deeper understanding, really digging into the microbial shifts, the metabolic pathways, even picking up on subtle behavioral cues, how that understanding can unlock solutions to these massive problems that might otherwise just fly under the radar.
Right.
This whole integrated approach, looking at everything from the microscopic level right up to herd economics, it's powerful, and it maybe should inspire us, you included, to look for those kinds of hidden connections and complex solutions in other areas, too.
That's a great point. What other silent profit robbers or underestimated problems might be lurking out there in any field, really, just waiting for someone to take a truly deep dive? Makes you think, doesn't it?
It certainly does.